kind of the reason why is, I think, well, first of all, I'm just kind of more interested in the organizational issues that affect us as healthcare providers, because sometimes we can be doing everything that we can to maintain our resiliency and even have some perhaps predisposition to being more resilient to stressful situations. But if the environment we're working in is incredibly challenging, that can be hard to overcome, or it may not compensate, right? So, in the same way, I think it's really just important to think about what organizations can do to support our job satisfaction and well-being. And I also focus on job satisfaction rather than career satisfaction. So for example, my career as a psychologist, I might be very satisfied with my choice of being a psychologist, but I might work in one environment, one job where I feel a lot of dissatisfaction, and then move to another job or an environment as a psychologist and feel more satisfaction. So again, I'm kind of more interested in the organization, the job, for this presentation. So that's sort of what I'm going to focus on, and how that can affect our well-being to the degree that we know that now. I come to this topic from, I've been a clinician since 1995. I've worked in, like you all, in settings that were quite stressful for people. And particularly one of my last jobs where I was a director of family services, and we worked with a couple hundred families that were homeless or had been formerly homeless and were child welfare involved. It was a really stressful situation. There was lots of reporting child abuse. There was seeing child abuse. There was seeing people going back to homelessness. It was pretty challenging. And what I began to realize was the way in which the work was affecting my staff, and the way in which my staff deteriorating was affecting our care and also our outcomes. And this is where I'm going to say some of what I may present to the end may seem a little pie in the sky, but what I will say is that I then took every opportunity I could to present on the way in which the work was affecting my staff and turnover and outcomes. And we wound up getting pretty good sized grants from Sisters of Charity Foundation, the Gunn Foundation, and the Cleveland Foundation to be able to implement some practices to help our staff be more satisfied with their work. And we were able to then demonstrate that those changes had increased their tenure and increased the satisfaction of clients. Because our clients would say, it's hard that my case manager, my social worker, or my counselor keeps changing. So anyways, some of it may seem a little pie in the sky, but sometimes you can get some of these things addressed. So we're going to look at the importance of supporting clinician satisfaction and wellness, just kind of get a little bit into the concepts of what is professional resilience, job satisfaction, and wellness, and then present some of what we know so far for healthcare providers. Seems to be, I don't know if we can say evidence-based yet, but empirically supported initiatives to support job satisfaction. Oh, this is Dr. Ballister. This is back. He said this a while ago, and I just think this is, I think, when you think about a work group, this is, I think, is something that to me really resonated with how a colleague can really help another colleague in a way that doesn't take very long. And essentially, the story behind this, and there's the link there at the bottom. Was that unbeknownst to the person who sent the email, the person who received the email was contemplating suicide. So the person sending the email had no idea, right? But nonetheless knew that this is my colleague, this was probably a hard situation that they lost a patient, and I'm going to send a nice message. And it's the message to me is really beautiful. Hey, I'm so sorry about your patient. That sucks. I'm very thankful that we have you here as an excellent physician. I can't pronounce that word, so I just substitute physician to learn from. You take care of so many sick patients and do a marvelous job educating us how to do it safely, skillfully, and compassionately well. Thank you for that. What a nice, specific, affirming email to send to somebody. And essentially what the person said was after receiving it, it got them off that train of thought of thinking about ending their life by suicide. So I think that's just a message to all of us that sometimes it's important to take the extra step to be kind and affirming of our colleagues. because you never know what somebody's going through. We're all pretty good at hiding things. So thank you, Dr. Doster, for setting that. So the quadruple aim of healthcare, many of you have probably heard about this. So the first three are, the enhancing the patient experience, improving population health, and reducing costs. The fourth aim, which was kind of introduced by Brodenheimer and Sinsky, was improving the work life of healthcare providers by promoting employee wellness through advocacy, collaboration, and innovative programming focused on individual and system resilience. And I really like because if we're working on this, it does require advocacy, collaboration, and some creativity to figure out what's the best way to do this, and all of our settings are different. So it's going to look different in different settings. So, why would we bother with that fourth element, right? So there's research to suggest it's at this point more correlational research, but nonetheless a pretty strong body of correlational research that suggests that by promoting satisfaction and wellness of healthcare providers, the healthcare systems are more likely to reach those other goals that everybody pretty much thinks are important. So better quality of care, improved patient safety, and then higher retention rates, and that's obviously for the employees, for the healthcare providers. And I'm going to reference it later, but you're going to see this JAMA Steps Forward, or is it AMA Steps Forward link, and it kind of gives you, it's really kind of compile the best practices in terms of promoting healthcare provider wellness, and kind of goes through different specific examples of things that you could do.
I think they even have a module on Project Echo.
They probably do. Yeah, I was thinking, I was going to say there's also research that suggests that Project Echo, for some reason it says, oh, you moved the thing, that Project Echo improves participant job satisfaction. I didn't include that because it seemed tacky to fan our own faces or whatever. But there is research to suggest that, and I think a lot of it has to do with some of those things that we know improve well-being, and that's feeling more confident in your work because maybe you learned something new, and also just decreasing the career isolation or the social isolation. So it's still not clicking forward. There we go. Okay. So, in physician shortages, so, I made the same argument at my job. Before I got grant funding, I was able to get a little bit of money out of our CFO for some workplace initiatives by basically making the argument that to the lost productivity and then the time training somebody where they're not achieving as much productivity was such a cost deterrent, that whole process, that it was made of more of a financial sense to give somebody an hour a week to work on resiliency, rather than if we could make the argument that 1 hour a week would lead people to stay on the job longer, which we were ultimately able to do. So there's some financial ways you can make that argument that people might buy into, because ultimately these are our businesses and you have to sort of make that argument. And then we know that beyond that, beyond the money, and probably I would say more important, is that physicians have suicide rates that are higher than the general population. And this is something that is really unacceptable, and therefore we need to think about what are we doing on a system level to create this issue. I thought about Amy. Amy, I think you did your training at the Mayo Clinic, if I'm correct. No, I think so. But anyways, you'll correct me if I'm wrong. But there was a lot of research out of the Mayo Clinic. They seem to kind of have cornered the market on these organizational initiatives to promote physician wellness. So career resiliency, that's the mindset that empowers people to pursue their career goals in the face of adversity, such as job losses, toxic work environments, and failed projects. So it's essentially like what we think of resiliency, but specific to career. Like I said, we're not going to spend a lot of time on that. This is sort of where we're going to spend a little bit more time, is job and employee satisfaction. So again, that's distinct from career. So again, as a physician, you may be satisfied with being a physician, but you may be dissatisfied with your current work environment, right? So it's workers' connectedness with their job, whether they like the job or individual aspects of the job. So it kind of gets into the minutia of that particular job. And it has cognitive, so thinking like, yes, I really, I find my work very intellectually engaging and I feel challenged and I like that. That'd be cognitive dimension. Affective could be, I feel excited or energized or happy when I'm at work, right? And behavioral, and that can be like coming to work. So if you're coming to work and you're coming to work on time and you are more engaged and more productive, those would be other ways of kind of measuring job or employee satisfaction. So these are ways when you look at the literature on physician, and when I say physician, it's also healthcare provider satisfaction. They do it in a number of ways. So it could be as simple as asking people, how satisfied are you with your career? That gets more at the career part. How satisfied are you with your specialty? And there's a 5-point Likert scale, you know, from very unsatisfied to very satisfied. How satisfied are you with your work-life balance? That's another question that you'll see in studies sometimes. The AMA came up with this mini-Z survey, which I kind of like, and there's a good bit of psychometric evidence to support its effectiveness. What I like about it is it gets at dimensions of burnout, like the Maslow, but it's shorter. And it also gets at other kind of variables that we might think of are important. So I think I have, so it's 10 items and one open-ended question. The one open-ended question is, if you're planning on leaving your practice, how come? But it says satisfaction, stress, burnout, work control, chaos related to your work, values alignment, how consistent or how congruent are my values as an employee with the overall mission of the job I'm on, teamwork, documentation, time pressure, and the electronic health record comes up over and over and over again in this literature. But essentially, this is a way of really measuring job satisfaction, because if you look at it, it has to do with things specific to that job. So it gets an overall satisfaction, burnout, great deal of stress because of the job, control work overload, work atmosphere. Professional values are well aligned with leaders, degree to which care team works efficiently together, amount of time spent on EMR at home, proficiency with the EMR, and time for documentation. So those are the variables that it encompasses, that AMA mini-Z survey. So then we're thinking about job satisfaction, and then this is wellness, and the medical schools are really adopting this model, and I know SUMA has adopted this model as well, is these 8 dimensions of wellness. So when you're thinking about an employee, you're thinking about a variety of factors that make up overall wellness. And to some degree, the work will, you see occupational wellness as one of those variables, though they're obviously all interactive, right? So for example, if my job required that I have to work on Saturdays for the most part, or I feel pressure to work on Saturdays when I identify as Jewish, and that's a day I typically would be going to temple, then my occupational world is going to affect my spiritual world, right? So they're not in these distinct silos. They interact with one another. But there's an emotional dimension to wellness. There's an environmental dimension to wellness. There's the intellectual dimension to wellness, physical dimension, occupational, spiritual, social, and financial. So those are the 8 dimensions. And like I mentioned, in medical schools, and as well as I know SUMA, there seems to be this movement to begin to think about wellness initiatives in organizations based on this. So if, for example, at SUMA, you're going to have financial management classes. There's going to be opportunities to spiritual practice. There's going to be things to promote physical wellness and intellectual wellness through your job planning and being challenged at work and being able to get into new experiences. So that's the kind of like some of the ways you would think about, okay, how would an organization look at this and make sure that they were adhering as best they could to the group's ability to feel some sort of sense of that being promoted for people. So these are other tools that you can look at that kind of get at job satisfaction or burnout. So there's the professional quality of life scale, compassion, satisfaction, and fatigue. What I like about that is, I always say an accountant can be burned out, right? Just the same way as a psychologist or a physician or a pharmacist can be burned out, or a social worker. Any of those folks can experience burnout. the thing about healthcare providers is we have this other sort of aspect of burnout or affects our wellness that's around compassion, satisfaction, or traumatic stress. Like we see people pass away. We tell people bad news that have to do with their health. We hear people's trauma stories that accountants and some of the professions don't necessarily have. So I'm sure they have their own issues, right, that relate to burnout, but they don't necessarily have compassion, satisfaction, traumatic stress. And the idea is that it's important when you're in these healthcare settings to think about like the degree to which you're taking on that secondary traumatic stress. And there's research to suggest healthcare providers over time have PTSD symptoms similar to people who have PTSD, who haven't actually directly experienced a traumatic event. They've seen it vicariously. But at the same token, people experience compassion satisfaction by working with people through those issues. I know one of the things I've said is that seeing what I've seen people survive is oftentimes inspiring to me. And I'm going through something like COVID-19 and my kids having to be home for 3 weeks. And I will recall, yeah, that kind of sucks. But my God, I've watched people who experience things that I couldn't imagine getting through. And it's kind of like it reorients me to the capabilities of people and to kind of put my stress in perspective. The MASLAC, we're probably familiar with that. That's in a lot of studies as well when you're looking at occupational satisfaction. Sometimes the MASLAC is actually used as a way of gauging, I don't think this is exactly correct, but it will be used as a gauge of job satisfaction. So if you're low in the MASLAC burnout inventory, then they would argue then you're high in job satisfaction. I don't think we can make that argument, but nonetheless, that's what you'll see in a lot of the literature. So, where do we intervene for this? So if we're trying to help people feel more well and more satisfied with their jobs, what are the levels of intervention? Obviously, there's individual level variables, and I know Laura Barr, I think, touched on a lot of that last week. There's also work group levels of intervention in that slide at the very beginning that Dr. Ballister shared. That's an example of how a work group can pick one another up, right, and take the time to be compassionate towards one another. I'm going to focus a little bit more at the end of this on organization, which obviously does impact work group and individual, but a little bit more on the organizational level. So in 2019, these folks from the Mayo Clinic did a systematic review. I love it when there's systematic reviews because it makes things very helpful. They have looked at the studies. So they looked at the literature from 2007 to 2018 to look at the impact of organization-directed workplace interventions on physician burnout, stress, and satisfaction. So it's exactly what it sounds like. Is they were looking at not what can physicians do to manage their burnout, like doing more exercise or whatever. It was what can the organization do. They found 50 studies that they believed were of a high enough quality and were tapped that specific issue. And 35 of those 50, so 70% of the studies reported interventions that successfully improved the three measures of physician burnout, but also job satisfaction. So they improved job satisfaction and stress, so reduced stress. So what did they find? Essentially, the largest benefits they put into two categories: improved processes and teamwork. So improved processes were workflow changes and policy changes. So some of that involved, and it gets kind of, because you're looking at a number of studies and a number of organizations, so you kind of have to think about it like they cast broad strokes, but streamlining prescribing tasks. And one thing we'll see is that medical assistants were much more empowered in a lot of these models, but we'll get to that in teamwork. Establishing quality metrics. So this idea of the team getting together to look at what were the outcomes related to improving triage or workflow, and then how are we going to measure that over time to see if what we're doing is effective. Changing workflows via evidence-based practices like Six Sigma. Emily Murphy on here is a Six Sigma yellow belt, I think. Green. Oh yeah, you're a yellow belt, right, Jamie?
Almost.
Almost yellow belt. Yeah, and actually our president at Neomed, and this is really what they highlighted. And then I was like, whoa, okay. So I didn't just pick it out because Neomed's doing it. It was what was indicated in this article, example of an evidence-based practice. But at Neomed, our president's a proponent of Six Sigma, and we're beginning to go through classes, some of us, around Six Sigma processes. And then improved routine screening processes. So those sort of improved processes, I think it'll become a little bit more operationalized though with the team-based care because some of these overlap. So the teamwork, so the medical assistant, in a lot of these studies, a medical assistant accompanied the physician or the provider into the session. And then they completed the EHR documentation while the physician was doing their work. The medical assistant also then, based having had a relationship with that patient in those settings, did health coaching for the person, so perhaps met with them before or after the session. And they also managed population health in between visit healthcare. So they would be the ones, and obviously this is under the supervision of the physician, but they would be helping to sort of address any issues that came up over, between sessions. Some of them actually had full-time clerical help for a group of physicians, or where they were paid full-time to do all the clerical responsibilities for the physicians. And again, I think this gets to that cost effectiveness. They were able to make the argument that paying for these full-time clerical help was actually cost effective if it would keep physicians in that particular job, and therefore you're not replacing people. Doing other expanded team. Oh, the other interesting thing is the medical assistants liked it. So their satisfaction with their job improved, which was not necessarily predicted. It expanded the team responsibilities. So again, that would depend perhaps on your setting, right? But trying to give people more responsibilities within their scope of practice to alleviate some of the burden from the direct care providers. And then there was the improved communication among physicians. So some of it was actually architectural with having more shared spaces, but also doing like what I did at Frontline in Cleveland, where there was time where people's productivity was compensated for them to do things like get in groups and talk about not only the basic operation kind of issues that were coming up, but also shared patient issues that were coming up. But also they even had time where they were doing work on resiliency and on burnout and talking about their own mental health and well-being. So it was a number of different ways. So it wasn't always just coming there to talk about the patient care, but again, that time was compensated so that physicians and other providers weren't then needing to make up that productivity based on going to that meeting. And that's where I said I was actually able to get grant funding. And before that, though, our CFO agreed, okay, let's try this and see. And our CFO believed in our organization that it was a cost-effective measure to give people an hour of time each week where they weren't responsible for productivity and they were doing these type of tasks. So the AMA steps forward. So this is, and it gets in way more detail. It's a pretty comprehensive document, so I'm just getting the highlights. But first of all, sort of, so if you're going to try and look at wellness or job satisfaction as an indicator at your practice, you'd be establishing that as an indicator, and you'd want to know how you're going to measure that. So maybe you're going to use that AMA-Z, or maybe you're going to use the Maslach burnout inventory, or maybe you're going to come up with some other indicator for your practice that's going to be how you operationalize wellness, right? And then you're going to have a wellness committee and or choose a wellness champion. I did this at 2 organizations I worked at, where we had a committee that met regularly and had a particular person who was responsible for doing some of that. You conduct some kind of annual wellness survey. So you're looking at it over time to see how are the interventions making a difference, or are they not making a difference? You meet regularly with leaders and or team members to discuss data and interventions to promote well-being. So it's an iterative process, right? You're trying things and seeing if they work and using data to determine if it works, and then going from there. initiate selected interventions. And again, those interventions may change over time, or you may find that what you selected was effective. Repeat the survey within the year, implementing the new interventions to evaluate how's it going, did it make a difference? And then obviously, like what any researcher would do, you're seeking answers within the data, refining the interventions, continue to make improvements. So again, it's this very iterative process. Some other things, just a couple of things, the compassion fatigue workbook. So we use that at Frontline. I know they've used that in other settings. So that would be something that the team would do periodically with that hour of free time that they would have to be doing this. I find it a really helpful workbook, especially for healthcare providers who are dealing with a lot of distress related to loss or just the distress of being compassionate all the time, which is it can run out sometimes, or it can be hard to keep it up. Trauma stewardship, an everyday guide to caring for people while caring for others, is another really nice manual that you can go through around basically promoting your own well-being while a large part of your life is devoted to helping other people be well. I've mentioned this before, but we had at Frontline where I worked, we had a pretty interesting study. It was not, didn't go through a peer-reviewed journal process or any of that, so take it with a grain of salt. But what we did was when we had basically all provider types there, pharmacists, physicians, social workers, psychologists, peer support specialists, you kind of name it, case managers. And we randomly assigned a cross-section of that those provider groups to 2 different conditions. One condition was they had a regularly assigned and kind of like mandated 15-minute break, and again, where they weren't responsible for any productivity, and that was over and above their hour of lunch. So a 15-minute break where they weren't supposed to do anything deliberate, but just kind of do whatever they would do on a normal 15-minute break. Unfortunately, the place where I worked, there was a lot of smoking that went on for that 15-minute break, but what are you gonna do? But the other group had a 15-minute break where they were asked to either do daily meditation, so they learned a meditation script and did that, or if they were religious, they could use that 15 minutes to practice their religion, because there's research to suggest religiosity is in many ways similar to meditation. So anyways, what they found was that, and so it was longitudinal data, but also comparison groups. And what they found was that the 15-minute group that just took a break, that they didn't see any significant changes within that group. Basically, they were just as distressed as they had been. And we were looking at sleep and at workplace anxiety. And then the group that did the 15 minutes of meditation, they had a significant increase in reported sleep and a significant decrease in reported anxiety, both within group and in comparison to the other group. And then third, the religious group had the most robust outcomes. They had even more improved sleep and even significantly more decreased anxiety in comparison to the meditation group and the other group. So we found that was pretty interesting. That study went on for 6 months. And then we also created 2 rooms for the sole purpose of promoting staff resiliency, and we encouraged the staff to create that room how they wanted to and to have in it what they wanted to have. And then staff could go in and pop in there during the day and kind of get away from everybody and use the materials that were in there. There's everything from like squeeze balls to things that people could do art to like fragrances to magazines to all kinds of stuff. So anyways, there's interesting things that one can do. So those are some articles about that. And thank you all for hearing me out.